Thank you very much. It's a great pleasure to have this opportunity to speak to you and particularly to share the stage with my colleague Christine Middlemiss. And as I'm sure Christine and many of the audience will agree, One Health is a particularly important topic, and the junction between biosecurity governance and One Health is one that is important at the international, national and local levels. So I'll start by looking at the international and national issues, and hope that Christine can take it further from there. And I can't get my slide, there we are, to advance. So the concept of One Health is not particularly new, but to reinforce that, it's the collaborative efforts of multiple disciplines working locally, nationally, globally to attain optimal health for people, animals, and our environment. And it's, as I said, it's not a new concept, but it's one that's become more greatly and widely used since the early 2000s. Biosecurity is a fundamental One Health issue. At its core, biosecurity is about managing risk, and the World Organization for Animal Health, the OIE, defines biosecurity as a set of management and physical measures designed to reduce the risk of introduction, establishment, and spread of animal diseases, infections, or infestations to or from and within an animal population. And we know that some animal diseases have direct and indirect human health consequences. For example, zoonotic diseases like influenza viruses, or and some also impact on food security and prosperity. We also know that some disease events have significant impacts on economy and prosperity, and including through productivity losses and trade impacts. So we need to go beyond considering the consequences to animal and human health to include welfare, prosperity, and the direct and indirect impacts of animal health that can occur on the environment. And conversely, we cannot forget the direct and indirect impacts of human and environmental health issues on animal health and welfare. We know that a health impact on a farmer will impact on the health of their animals, and likewise an environmental health issue will have impacts on both the farmer and their livestock. So by adopting a One Health approach, biosecurity risk can be more effectively managed, and a comprehensive approach can be taken. Managing threats and optimizing health will only become more important. This is because the world is under increasing pressure. There is more and more biosecurity risks, which are constantly evolving and changing, driven largely by human behavior. And as these threats continue to escalate in both scale and frequency, the urgency of adopting a One Health approach, at least to keep pace, is only becoming more critical. COVID-19, the pandemic, has given us an insight into a One Health approach, with the media understanding and picking up on the issue that this is a spillover event from wildlife that was driven by changes in the environment. However, implementation of a One Health approach is often lacking. And without genuine One Health activities to effectively understand and address human, animal, and environmental health threats, we risk being overwhelmed trying to unsuccessfully manage and respond to events rather than prevent them from occurring in the first place. And we need good governance. Biosecurity is a legal issue, and for good reason. It must be underpinned by robust governance, legislation, policies, and other arrangements to ensure that biosecurity measures take effect and operate as they're intended. If we look at the global level, there's international governance through the WHO, OIE, and FAO, and that tripartite had recently brought in the United Nations Environment Programme, and the inclusion of UNEP to form a tripartite plus is very welcome and recognises the importance of the environment and its health. The tripartite has led efforts to promote cross-sectoral collaboration addressing zoonotic risks and other public health threats. And a number of support tools and products have come out of that. The Tripartite Zoonoses Guide, the OIE's Performance of Veterinary Services, the PVS tool, which evaluates the performance of veterinary services. The WHO has got a joint external evaluation framework, which again evaluates the performance of human health services, and associated bridging workshops with participation from human and animal health sectors, which the Tripartite and its members are holding on a regular basis. So One Health at the national level, it was recognised in 2014 through the OIE-WH operational framework that for good governance at the human and animal health interface, it's a shared responsibility. And that framework recognises that governance as a human and animal health systems which comply with international regulations. So applying those WHO international health regulations, the OIE veterinary standards regulations is a necessary global governance measure. But those measures and that understanding could be extended further to include the environment and non-livestock animals such as wildlife. Here in Australia, agricultural biosecurity is built on the understanding that it's a shared responsibility. The government at the national level plays its role at the border, industry play their role behind the border and on farm, states play their role in responding to incursions, but industry also play a role in ensuring that they comply with regulations and that they report incursions should they occur. And then there's a raft of formal and informal mechanisms that support the One Health collaboration. So we have a communicable diseases network, and the veterinary services contribute to the human health discussions there. We invite our human health colleagues to contribute to and comment upon risk assessments that we're undertaking in the animal biosecurity sector. My role as Chief Veterinary Officer is complemented by a Chief Plant Protection Officer, and recently we've created a Chief Environmental Biosecurity Officer. So the three chiefs work together, and we collaborate obviously with the Chief Medical Officer. And a good example of that is in the case of antimicrobial resistance, where together with the Chief Medical Officer, I have stood up the national strategy, and that's reflected at the global level through the mandate that was delivered by WHO for nations to have a response strategy to AMR, and then the implementation of that in a One Health sense by OIE, FAO, Codex, and other groupings. And we've seen a number of other groupings emerge recently. One of those is the One Health Global Leaders Group on antimicrobial resistance, and a number of ministers and social and political leaders are contributing to that. In the case of Australia, our Environment Minister, Minister Susan Lee, is a strong advocate for action to combat the threat of antimicrobial resistance. And it's pleasing that she's a member of that group. So to turn to the future, the challenges that we face are immense, and they require comprehensive solutions. And the only way we're going to be able to develop comprehensive solutions is if we take a One Health approach. And those challenges are antimicrobial resistance, pandemics, food insecurity, environmental emergencies, and a raft of other issues that are yet to emerge. The only solution is one that brings together all of the relevant sectors and disciplines, including health and environment professionals, sociologists and economists. We can't consider solutions to the challenges that we face unless we also recognise that these are human issues. For example, African swine fever is not being spread by pigs, but by people and people moving pigs and pig products. And so understanding that sociological context is important, as is understanding the economic context and the economic impacts. all of this needs to be bound together in a One Health framework, and therefore siloed approaches will not deliver the changes that we need. And biosecurity at the farm or the clinic level, at the national level, is a critical contributor. And that's why the development of standards through the intergovernmental bodies such as OIE and Codex are so important. They not only support trade, but they underpin and support enhanced biosecurity. And that's for the benefit of all, not only for human health and animal health, but also our environment and our wildlife. And to keep the momentum going, we all depend on this collaborative framework. Thank you very much.